Hello, my name is Nick Clausen, and today I'm going to be talking to you about diode laser optimization. The first thing, and I will say the most important thing, if you want your diode results to be great and have a great patient experience, what I want you to do is to turn your laser down. Always use the least amount of power to attain your clinical objective. So many times I see dentists turn their diodes way up, and they're actually not even using the laser energy to cut, they're using thermal energy. So use the least amount of power to attain your clinical objective because there is that thermal component of lasers and it can be hot and you get tissue that looks like that. And that's not comfortable for the patient and it doesn't heal as well. Now, just so that you know, a lot of the older lasers were either on all the time or they were gated or pulsed. And usually they're on half the time and off, on half the time, off half the time, on half the time, off half the time. So they were a little bit weaker, and we did have to power that technology up a little bit. But the newer diode technology, they do what's called micropulsing. And what that means is the laser's on for a fraction of a second and then off. So we can have higher powers to cut more efficiently and effectively. It's like running my finger over that candle. It hurts when I go slow, but if I go really fast, it doesn't hurt. And that's actually more powerful. And what that gives us the ability to do is to cut more efficiently, but we can also do more with just topical. So if you're seeing this charring, I don't want you to see that. Power it down, okay? And also know what kind of technology that you have. Not all diodes are created equally. So we want to, if possible, the newer lasers have that micropulsing capabilities. The next thing I want you to do is physically slow your hand movements down. Remember this, the slower you move your hand, the faster the laser cuts. So many dentists do what I call feathering, and they move the laser tip really quick. The laser doesn't cut when you move that fast. You need to move methodically slow. You need to almost think like a sloth. So the slower you move your laser, the faster it cuts. Next, everything happens at the very distal center of that tip, at the very end. Nothing happens off to the sides, but you need to, your technique and closeness needs to be, if you're writing on coarse paper with a felt tip pen, that's how close to the tissue you need to be. I don't want you pushing in. If you push writing with this inkwell pen, you would be splatter all over. That's what you get bad results when you push with the laser, but you want to be just on the surface, super close to the surface so that that laser energy can interact. Now, the other thing is I don't want you to feel like you're strumming a guitar. If you can feel tension on the side when you move from side to side, you're pushing. You're not cutting with that fiber. The laser energy is doing it. You got to let the laser energy do it. So I don't want you to feel like you're strumming a guitar. You should lift up and you should be hovering over those fibrotic bands. That will help you out tremendously. And last, tension is your friend. I want you to have tension because then you can follow the tension. Otherwise, the tissue shrivels up into itself. So those Addison teeth forceps are really great. So the more tension you have, the better. So I think with these pearls, your laser will be much more efficient and much more effective.